As we brought you stories during Breast Cancer Awareness Month, you'll hear one statistic over and over. 1 in 8 women will develop breast cancer in their lifetime. And one of the best places for treatment is right here in Birmingham, the O'Neal Comprehensive Cancer Center at UAB. Joining us now with more on why this center is known worldwide is Dr. Barry Sleckman, the director of the O'Neal Comprehensive Cancer Center. Dr. Sleckman, it's so great to see you this morning.
Thank you. It's great to see you, Andrea.
It's an honor to talk with you. Tell us what sets the O'Neal Cancer Center apart from other treatment centers.
Well, as you said, UAB's O'Neal Comprehensive Cancer Center is one of only 51 cancer centers in the country that's designated by the National Cancer Institute of the National Institutes of Health, and it's the only one in the state of Alabama. That designation requires that we do cutting-edge research into cancer and use that research to develop treatments and bring those treatments to patients through clinical trials that not only teach us about cancer, but really have meaningful effects on patients and their cancer outcomes.
Well, you said it, UAB always on the cutting edge of research. You're a brilliant mind, so forgive this layman's question, but I think so many people would like to know, how close are we to curing, say, breast cancer? We're so focused on that this month.
Well, I think what we should focus on is making steps towards improving the treatments and the survival of patients with breast cancer. The reality is that breast cancer is multiple different diseases caused by multiple different defects in breast cancer cells. And we're going to need to learn about all those defects and then how to attack those defects surgically with treatments.
How has treatment changed, and what does the future hold there with the folks you work with at UAB?
I think the treatment of cancer has changed in a revolutionary way in the last 20 years. When I started medicine, we treated cancer simply by providing toxins to the cells because they divide. And now, fast forward to 2021, we treat cancer based on what we learn in the laboratory about what are the Achilles heels of different cancer cells.
We have about 15 seconds left. Can you bottom line it and give us a word of hope, people watching now who are fighting cancer, particularly breast cancer, that you all are working every day for them?
I think that there's a lot of reason to have hope. And what I tell everybody about cancer is that it really matters where you're treated first. You really need to go and go to an NCI designated cancer center and really explore your different options for treatment, not just standard of care, but whether or not you might benefit from a clinical trial.
Go to the best of the best. Dr. Sleckman, thank you so much for joining us this morning. We'll be right back here on the CBS 42 Morning News.